Ruth, the stroke nurse here at beautiful RUH. I'm here with my friend Jess and Cassie behind the camera, and we're going to do a quick little bit of stroke teaching. One of my favorite nursing theorists, Virginia Henderson, said that the unique role of a nurse is to do for their patients what the patient would do for themselves if they were able to. So one of the things that our stroke patients can't do for themselves is safely position themselves in bed or in chair. So let's take a look at some of the ways we can do that for our patients. So we're going to work with Jess and pretend that she has a left-sided hemiparesis. You will see a left-sided hemiparesis in a patient who has a right subcortical or lacunar infarct or a right MCA type of syndrome. So really easy. We've propped up her left arm on a pillow. We're trying to protect her shoulder, her elbow, her wrist, as well as prevent or ease any dependent edema she might experience because that arm is flaccid. When we move down, we also have her leg propped up on a pillow. Again, we're protecting her joints for sure, but also alleviating pressure on the back of her heel because she maybe has hemisensory issues as well, so can't feel that there's problems or pressure on her heel, but also she can't move it to alleviate and shift pressure. So that's how you would position a left hemiparetic patient on their back. So here we have Jess laying on her unaffected side. So her right side moves, she can feel it, it's fine. It's the left side here she's still experiencing hemiparesis in. So you want to try and have her head and her back aligned and straight. You want her shoulder and her pelvis to kind of be rolled forward a little bit. Again, her affected arm and leg are supported on pillows just for the same reasons we supported them when she was moving on her back. Now we've all seen those patients that don't have a pillow under that affected arm and their arms, like it's crazy, you go in and because they can't feel, they can't move, they can't self-correct. So you are really, and when you're moving these patients, you want to support their limbs. You don't just grab it and move it around. That can be really hard on the joints. So you want to support them as best you can when you're being the arm that they can't control for themselves. And then gently rest it. How's that feel, Jess? Comfy enough?
Yeah, great.
Okay. There's also a pillow under the back so she won't kind of tend to roll back onto the back. I have Jess laying on her hemiparetic or her affected side. So she's laying on the left side that's having the paralysis. So you want to protect the shoulder. Watch that they're not laying right on the shoulder. Kind of bring it forward a little bit. Arm flat, palm up. And then the affected leg, her left leg, is again kind of back and just knee slightly bent. You don't want to position patients for long periods of time on their affected side, especially if they have hemisensory issues because they can't feel if there's wrinkles or sensory issues happening that a normal body would say, oh, time to move. But it's certainly important to get them onto that side when they're immobile. Okay, so here we are finally with Jess sitting up in bed. And let's remember Jess is a right MCA stroke and she is neglecting her left, so she's not aware of it, she's inattentive, she has a gaze preference over to the right hand side. And so if I didn't have her propped up like this, you know what Jess is gonna do? Oh no, she's leaning way over to the left. So that's why we get this pillow all up in her business under that shoulder, protecting the shoulder. And again, we just elevate that left hand to try and protect the elbow, protect the wrist, and prevent any kind of edema. The other thing that's kind of tricky with right MCAs is they can really have a gaze preference where they don't want to look over this way at all. So trying to get a pillow to kind of get their face over this way is tricky, but you can work on doing it. The other thing is put anything stimulating onto the left-hand side so that they want to turn their head. So if you have a room with a window, have that window on the left side of their bed. If family comes to visit, for sure these patients are going to be tired because stroke is tiring, so give them a break, let the family go to the right-hand side. But once in a while, have them come to visit on the left. So again, the patient wants to come over to the left. And because I'm so stimulating, Jess is going to look over. Come on, Jess. Come on.
Oh, hi, Ruth.
Guys, you know what it's always a good time for? A mouth care moment. And this mouth care moment is brought to you by Paravex. What's Paravex, you say? Paravex is an alcohol-free, antibacterial, non-foaming mouth cleansing gel. It's an antibacterial agent that protects against dental plaque and gingivitis. It replaces toothpaste for patients who have dysphagia or can't spit. It's also used in patients who are at high risk for aspiration, as foam from traditional toothpaste has a higher risk of being aspirated. Yikes. It can be used also to lubricate the oral cavity, which is beneficial for patients who have a really dry mouth and who are NPO. Paravex will heal dry, cracked lips as the water-based lubricant soaks into the oral tissues, healing them. It also helps break up that nasty plaque that adheres to the tongue and is frequently thought to be thrush. So, because we're using Paravex, we don't have to use antifungal treatments that are overprescribed, as we all know. So this mouth care moment has been brought to you by Paravex, so check it out on a cart near you. Okay, so we've switched it around and now Jess has had a left middle cerebral artery stroke, or maybe a left subcortical or lacunar infarct, or a hemorrhagic stroke. Both will kind of look the same. So she is hemiparetic on the right side, and she's up in her Broda chair, which is broken because, let's face it, how often do we have perfectly functioning equipment in these hospitals? So depending on what kind of chairs you have, your occupational therapist may have fit your patient with a chair that will have a tray to actually support this arm, or maybe a curved hand rest that their hand can kind of curl around. Most of the time with our stroke patients, not most of the time, but sometimes they will have a grip that we have to open up, trying to prevent any contractures. So you might want to even put a little face cloth in their hand to help prevent it from tightening right up, lots of tone. But you certainly want to, again, protect the elbow, protect the wrist. Because she's a left MCA and has right-sided hemiparesis, she's going to want to lean over to the right again, so you kind of prop that pillow right under her shoulder to help her kind of sit up, because you want her as aligned as she can be. And then in terms of feet positioning, sometimes your strokes will be able to pedal around the unit, and if that's the case, you just want to make sure there's a pedal underneath. Well, either feet flat on the floor or a pedal underneath, pedal underneath the affected side, so that she can kind of mobilize on her own with her good side. And that's kind of what we want your patient to look like when they're up in the chair. What we sometimes see, probably not on your unit, but the affected side, we'll see the arm. What might happen with that arm, especially in a regular wheelchair? This arm might be, hello, look at this dependent arm. You know what happens in this situation? We get subluxed shoulders, and we are better nurses than that, so we want to protect those shoulders, protect the wrist, protect the elbow. Again, when we're mobilizing these arms, we're protecting all of the joints when we're moving our patients around. So, Jess, you're all cozied in here. How does it feel?
Great, Ruth. Thanks.
Okay, well, that wraps up positioning your patient in bed and chair. Sometimes there'll be a stroke patient that needs a little extra help, and so you can talk to your physiotherapist or occupational therapist about different kinds of tools or modalities to help with your patient and do, support some of those challenging tone issues or flaccid issues that your patients might have. I want to remind you and encourage you that you can do a lot with a little. A few pillows goes a long way. If you're short on pillows, you can use some flannels to kind of support those affected limbs. Either way, you're exceptional nurses, and I know that you're going to provide exceptional care to your stroke patients. And as always, I would like you to save lives and improve functional outcomes.